So I've talked about total hip replacement, but there are more conservative types of replacement that can be used, and I'd just like to briefly mention resurfacing and conservative hip replacements, short stem devices that go in the femur. Now, I'm going to show you first of all the cup of a resurfacing. Just trying to not put this down here, I'm making too much noise. But this is the shell. This is the metal shell that's placed in the acetabulum. And again, you can see the surface is really quite highly textured here. It's coated with hydroxyapatite, and having made the shape, this is actually pushed in with a special instrument to hold it into place. And being a metal joint, this is the actually articular surface here, and this is made out of cobalt chrome. If this was a normal uncemented shell, the surgeon would put in another bearing here on top of the metal if polyethylene is going to be used, high density polyethylene or ceramic. But this is the other bit of the resurfacing, and this goes on top of the femoral head. So instead of taking the femoral head off, the femoral head is shaped, this is hollow, and the femoral head goes in here, and that fits on top of the femoral head, and this is the articulation here. So that is the resurfacing. If we look at a conservative hip replacement, I'm just going to show you side by side a fairly standard length femoral component which you've seen before. And I'm going to show you a conservative replacement here, so it's a pretty obvious difference. This just fits down the femoral neck, so it doesn't go below the femoral neck into the metaphysis here. So it's a lot more conservative and it fits on the femoral head, femoral shaft, and this goes on the top, and this is the ball here, and that may well articulate with a bearing such as that. Or you can use different combinations. It could indeed be a ceramic head on a metal liner. Just talking about resurfacing in terms of some difference to the surgical technique. I mean, I think for all intents and purposes it's very, very similar to a total hip replacement, and indeed access to the acetabulum is more difficult, and the surgical incision is often bigger with a resurfacing than with a standard hip. Many patients assume because it's a conservative inverted commas hip replacement the incision is smaller. In fact, the opposite is true, and the incision may be up to twice as long as the standard hip replacement incision. And this is because the femoral head isn't taken off, and therefore access to the acetabulum is a little bit more difficult and tricky, and the surgeon doesn't want to cause too much tension on the muscle, and therefore it's better to release structures to gain access. But the key difference is the femoral head is retained, and that shape, the femoral head is shaped, and hopefully we'll include some onlays and graphics just to demonstrate some of the fundamental differences, which are pretty intuitive. With conservative hip replacement, again, it's a similar process, except more of the femoral head is taken off. The femoral head is taken off, but the femoral neck is preserved, and then the internal part of the femoral neck is shaped with instruments so that a conservative hip replacement, if indeed it's selected, can be used to slot down the femoral neck.